So, hello friends, so as a part of this snippet series in AI in different sort of a disease conditions. So, I had previously covered AI in respiratory as a snippet. So, to just see what is the sort of advances that has happened in AI with regards to sepsis and what are all the published literature that are currently available as a part of snippet series. So, as you know, friends, so AI is a buzzword, and AI has been intruding into every specialty of ours and every system of our specialty. But we need to have some clarity as to where AI is making inroads. In respiratory, we saw how it is making inroads into automating calculation of certain resistance and compliance with breath to breath sort of a capturing of data and calibrating certain adjustments. So that's what we saw in respiratory system and phenotyping the idea. So in sepsis, what is AI doing? I think that is important. So just to recapitulate our memory about AI, so there is some subtle difference between machine learning and AI. AI is a system that you put in place which simulates a human intelligence, and there is some analytical process of the information that is captured and which is meant to guide the decision making by the analytical algorithms that are embedded in this. So those are the typical features of AI. So how the machine learning differs is machine learning pretty much is dependent on the large data set. It's a recurring pattern of the large data set that is archived and identifying certain patterns within the data and making some sense of the data by sort of looking at the patterns in which the data is captured or in which the data tends to recur is what machine learning. So that's a little subtle difference, although they both are used sort of interchangeably. So we look into what sort of difference AI is making with regards to sepsis. Just to summarily tell, AI in sepsis pretty much is being utilized to prognosticate and the accuracy with which it is able to prognosticate. See, now the buzzword in sepsis is trying to phenotype the type of patients. What do we mean by phenotype? Phenotyping is trying to identify the group of patients who do well with certain interventions and who do not do well with certain interventions, or either way, certain patients are meant to not do well. So it is trying to recognize and identify these patients. So that is one area in which AI is making inroads, and AI is also making inroads with regards to phenotyping the type of sepsis that may be there, and in comparison to SOFA score, how accurately AI by capturing all the variables is making a difference is what people are investigating, and they have created different algorithms. And let's go into this particular algorithms which was created called the ICE algorithms, which is AI sepsis expert. So simplistically, what these algorithms do. So what do we do in ICU? We sort of integrate clinical information, monitored variables, and all the investigative variables to diagnose, prognosticate, and treat accordingly. So similarly, AI, they are creating algorithms so that all variables are captured and some sense and semblance is made of the data. So here in ICE expert, ASFCs, they're capturing the heart rate, they're capturing the mean arterial pressure, and they're capturing all the electronic medical record data, which could include the history, which could include the investigations, so on and so. Basically, capture all the data, try to make sense of it. And another important tool is to try and see. So one thing I said is to prognosticate and see whether AI performs better than the conventional scoring tools to prognosticate. And the third thing, what they're doing is whether AI has ability to pick up the sepsis bit early, even before a clinical diagnosis is made. So when they use this ICE sort of a algorithms, so they could sort of identify or predict the occurrence of sepsis 4 hours prior. So this is the some sort of a benefit that they found with this ICE expert. And the area under curve, its ability to predict sepsis 4 hours prior to the clinical ability to recognize, identify sepsis was good, and area under curve was 0.85. So then this was the Swedish algorithm called the long short-term memory. So that's the name of the algorithm they created, where they applied this to 59 59,000 patients from you. I'm sure most of the listeners know what is Mimic 3 database. Mimic is Medical Information Mart in Intensive Care. So Medical Information Mart in Intensive Care, it's like a Flipkart or some sort of a large database. They have named it as that. It's a market. Medical Information Mart in Intensive Care is a sort of a repository of a lot of variables in intensive care and the data that is archived. So it's a database that is archived from globally. So people can access to this database, get the data, try to interpret data and make sense of it. So here they took the database of 59,000 patients and they sort of made sense of all the recorded findings. So all the notes, the vital signs and laboratory data. So they took all this data that was archived in the medical information mart in intensive care sort of a database. They took all the vital signs, laboratory data, and all the notes that were put and tried to determine the patient outcome. And they compared between two approaches, area under curve versus Cox proportional hazard. And they found that the area under curve that was derived from these data using AI algorithms called the long short-term memory was better and it could identify sepsis 20 hours prior to the onset. So this is the sort of advancement AI is making. So AI is increasingly being used to identify the occurrence of sepsis much earlier before it becomes clinical manifest by picking up the cues from the laboratory, from the clinical examination records, and from the vital signs. So this is where AI is making difference in sepsis. And this is another study from UK where they took 92 patients and they archived the data of all the cytokine markers. Like in ARDS, we saw P1 and P2. Here they took all the interleukin B levels, interleukin 6, 8, 10, tumor necrosis factor alpha, chemokine ligand mRNA. So they took the values of all this and tried to see if they can prognosticate and identify sepsis. And they fed all this data into the neural models and they found that its ability to identify the patients and their outcome, the outcome of the patients based on these levels attained good accuracy at 94.55% with a very high sensitivity. So this was based on mainly the investigative variables of the cytokine levels of various interleukins, tumor necrosis factor alpha and chemokine. They could very accurately predict the accuracy of outcome up to 94.55% in these patients. So this was from the Taiwan group, Yuan et al. So here they put the algorithms using sepsis 3 definition plus SOFA score. They took 106 features, which means see they take all the variables that as a clinicians you would need to help diagnose, to help prognosticate, to determine the types of treatment and to identify sepsis. So they took 106 features and they took all the organ dysfunction scores and the status of the infections that may be prevailing in these patients. And they looked at time to diagnosis of sepsis and accuracy was attained to more than 80%. So as you see, all these algorithms that are being developed in sepsis is one thing is to see how accurately one can prognosticate the outcome of these patients. And the second thing is how early you are able to recognize sepsis even before it becomes manifest clinically is what AI is making advances. And this is another one called SERA, which is Sepsis Early Risk Assessment Algorithms. And they found this algorithm warns the clinicians 2 hours in advance before the manifestation of sepsis. So this is from Singapore. So again, they compared this with clinical the conventional clinical examination, Q-SOFA and SOFA, which we use to diagnose sepsis, and SIRS. So they had two groups. One, they used conventional clinical means with Q-SOFA, SOFA, and SIRS. And they compared with this sort of an algorithm called the SIRA algorithm, sepsis early risk assessment. So what did they took? They took vital signs. They took the lab. So any algorithms you say, it is not invented out of any rocket science. It is integration, interpretation, analysis of all the data, which is clinical data, the monitored data, which is all the clinical vitals and investigative variables. That's all it is. It's no rocket science. They computer making sense and integrating these variables, which otherwise a human or an intensivist is doing every day, is what AI is doing in an algorithmic way. And they found it's outscored humans' ability with the area under curve ROC of 0.94, which means obviously with human there would be personal sort of a variability with regards to clinical acumen and with regards to their diligence and with regards to their systematic way of analyzing the data. So AI obviously with a defined algorithms was able to outscore the human's ability to do the sort of a risk assessment in patients with sepsis. So this is where we are heading, friends. So with regards to respiratory, we saw a distinctive sort of a approach of AI algorithms being used in sort of ventilatory settings and incorporating this software in the ventilator to assess every breath. But in sepsis, it is all about two things: to prognosticate and accurately predict the outcome of the patients based on the vitals that you interpret and all the clinical records that you interpret or the clinical progress that you interpret and the investigative modalities. And the second thing is to try and identify sepsis even before clinically they become overtly manifest. Trying to pick up the sepsis very early on is where certain sepsis algorithms are being utilized, friends. So, and this is how, just to showcase, if you go into the literature of these articles, which are all published in sort of a AI journal. So this is the algorithm that they develop. So as you say, the electronic medical records and they are fed along with the vitals investigations and the progress. So it's what human does is what computer is doing. So we had statistical tools where they could analyze the numbers, but here with AI, even the progress notes are being analyzed and making sense of all the progress notes that is being put, and data mining is done, and then they put it into the diagnosis algorithm, and then they're predicting it. So this is just to show the template as to how the algorithms are developed in AI. So that's about it, friends. So maybe in the next one or two snippets, I would do AI in trauma and AI in AKI or in the kidney, and maybe AI in other miscellaneous. So that would cover the whole AI progression that's happening in intensive care. So request all of you to submit your valuable work to a Journal of Acute Care. Of course, you can visit my website to read to this lecture. Thank you, friends. Thank you. Thank you, Varun.